I'm Dr. Johnna Nynas. I'm an OBGYN in Bemidji, Minnesota, and this is my Blue Chair story. I think my passion for working with women and the diverse populations that exist in rural Minnesota really comes from having grown up as a kid in rural Minnesota, seeing how factors that you normally wouldn't think about as contributing to your overall health really make an impact. How far you live from the hospital, whether or not you have money to put gas in your car, whether or not you walk into a building and feel safe, whether you feel someone staring at you suspiciously. Those are all things that I experienced firsthand, and things that when I became a physician, really wanted to make sure were not barriers for my patients to receive excellent care. I really believe that I never want the quality of my work or the level of care that I can provide to be compromised in any way by my zip code. I think the patients that really stick with me over time are those patients that you may meet them briefly in an ultrasound room to tell them that there's no heartbeat for their baby, and they go through all the follow-up and you help support them through this really devastating event in their life, and then they come back to you pregnant again, and then you are celebrating but also anxious, and you get them through that pregnancy and you hand them their rainbow baby, and there is no better feeling in the world than handing a family that baby. And then you might see them for the next pregnancy, and then you get to know their mom or their sister, and then you see them in the grocery store, or maybe your kids are in soccer together, and really you realize that not only are you a special provider to this family, but you're a special part of their community. And that is, to me, the most rewarding thing about rural medicine, is it's not about providing health care to individual people, it's about providing care to an entire community. I think one of the really unique and challenging aspects of my job is I have to be able to go from really difficult and challenging conversations with patients to really happy and joyous conversations with patients in an instant. One of the dreaded parts of my day is knowing that I have a new OB patient scheduled in my morning and seeing the ultrasound tech knock on my door, because it's never a good sign. And then hearing that the baby's not measuring the way they should be, or that there's no heartbeat. And it's devastating for that patient, whether I know them from before or it's my first time meeting them. And to be able to walk into that ultrasound room and talk to this family for the first time ever, and you're there to tell them that the pregnancy hasn't continued and it's not going to end in a live birth, is really difficult, and it's really humbling. It's gut-wrenching to hear these families cry, and it tears me up as well. But there's also significant joy within that experience, because it is an honor and a privilege to share that space with those families and to talk to them about what they're going through and to support them through to the other side of this. That's an extraordinary and humbling privilege that I have, and it is actually, even though it's hard, a patient interaction that I treasure. I tell patients every time I have to make this diagnosis, I said, if you remember anything from this entire conversation, number one, this is not your fault. And number two, there's always hope. More and more women are facing increasing distances to access prenatal care. Nearly half of the counties in the United States do not have labor and delivery services within their county, and that means nearly half of the women in the United States have to travel more than 30 minutes just to access a hospital with those services. Sanford Bemidji is one of the only remaining facilities that are providing true comprehensive high-risk obstetric care in the northern half of Minnesota. I think a lot about my patients who have had issues with substance abuse, issues with domestic violence, issues with unreliable housing, because those are significant barriers for anyone just to live a functional life, let alone access healthcare and take care of a baby. And resources are tight, everywhere. And I just hope every single day that they keep putting their faith in me and trusting us to help them and showing up in any way they can or communicate with me. One of my greatest joys is being stopped at the grocery store or Target and someone said, "Hey, it's great to see you. Do you remember this? Can you believe they're so big?" And I never get tired of that feeling, and it's always so exciting to see them and to hear how they're doing and see that their older siblings are doing great, and that's so rewarding. So honestly, it's like the best part of this job.